Hi, everyone. Welcome. My name is Lisa Honka, and I have a company called Your Key to Senior Living Options. During the pandemic, we have been interviewing experts, and today we are joined by Dr. Bonnie Farr. We're going to be learning today types of memory loss, what is normal and what is not, and what we can do. So we are so excited to have Dr. Farr here to join us. She comes from Renstar Clinical Research, so she has a lot of knowledge, and she's going to give us some tools and tips to just understand normal memory loss and what is not normal memory loss. So thanks everybody for joining us. And again, we're going to have questions and answers at the end. So we're looking forward to hearing what Dr. Farr has to tell us. So thank you again for joining us. Can you tell us a little bit about you and how you got started, and a little bit about Renstar before we work into your presentation? I think Maureen needs to take you off mute, so I think you have to click that button. There we go. So again, thanks for joining us.
Oh, thank you for having me. So in psychology, when you study psychology, right, obviously it's a pretty big field, and there's opportunities to specialize. And one of the ways psychologists can specialize is do additional training. So I spent time at the University of Michigan and did a lot of training on assessment. And so my expertise is really evaluation and assessment of anything brain related. So when I say that, it could be a stroke, it could be a traumatic brain injury, and it can be dementia and other kinds of memory loss. So after finishing the fellowship in Michigan, I moved down to South Florida. And then in 2008, my husband and I relocated to Ocala. Started working at Ocala Regional. They had a memory center there for a brief period, and then that kind of closed down. And I met some people from Renstar and connected with Renstar shortly after that. I want to say around 2011 or so. So I feel like it's been around 10 years, maybe Alyssa could correct me if I'm wrong, but that I've been working with Renstar as an evaluator and their clinical research department. I also have a private practice, and I do work here in Ocala. And that's kind of what we've been doing. It's an exciting time in research because, and we'll talk about this, that we're seeing some of the results, some of the FDA approval of drugs like Aduhelm, which is new, but not new to us. We've been studying this drug for a long time. So it is kind of an interesting time in research. There's a lot of good things happening. And I do think one of the most important lessons, at least I've learned, and I'm sure this is probably most everybody in this field, is that it's important to catch things early and quickly and intervene and make some pretty big changes. What even research has shown us is that by the time things become a problem, it's often hard to catch up that train at that point. So really early identification, early involvement is really certainly the trend, and certainly I think indicated in the best way to sort of try and get a hold of some of the memory changes that happen. So I can go into the slideshow. Does that sound good?
Great.
Okay.
Yes.
And then it will touch on some things, but certainly we'll have an option to talk about. Oh wait, I want to go here. Okay, so let me just make sure I can advance. So I am speaking on behalf of Renstar today, and kind of the topic that I refer to it as is how to keep your brain young, kind of slowing down the train. And it's a metaphor that I use here. Aging is something that happens, right, to our body, to our heart, to our organs, to our brain. And so there's always this continuum between normal aging, normal memory loss, and where we start to cross the line into something more. And it is a gray area. It's not always easy to sort of pinpoint exactly where things start to change and move into something like mild cognitive impairment or even further along in terms of dementia. So I just want to talk about the brain a little bit. It's kind of a complicated picture, but really what my testing and what even things like PET scans have been able to do is locate areas of the brain that are not functioning as well. The testing that I do, there's a cross section of different things that we look at, but our brain is specialized in functioning. And one of the most specific areas that we have a lot of attention focused on is the hippocampus. It's this blue little sliver here, and it's a backwards C. You have two hippocampi, one on your left and one on the right side of your brain. This is a specific area of the brain that's very important because it's responsible from transferring new information into storage, into memory. So the definition of Alzheimer's is really an amnestic memory disorder, which means new information is not able to be transferred. So what's really important about the hippocampus is if that starts to change, if that starts to get impacted by things happening in the brain, memory is absolutely disrupted. So let's talk a little bit about what is normal aging versus what is something more. So forgetting appointments but recalling them later would be pretty normal, right? Making occasional errors when balancing a checkbook, although I'm not really sure how many of us still do that with online banking. But getting confused about the day of the week. Often in retirement, people will say to me, every day's Saturday or every day's Friday. It doesn't necessarily mean anything in particular, but, oh, and even forgetting why you went into the kitchen. And that's a popular question that I get asked is, why do I lose? That's really losing your train of thought. And that also is something pretty typical of aging. But when we start to get lost in familiar places, when we start not to be able to recognize places that we've been before or that we should have some knowledge about, that tends to be a red flag. Naming issues, miscalling things. Sometimes it's something like hammer instead of pliers, but sometimes it's even more than that. Withdrawal from social activities, games, cards, even reading. People that are avid readers will tell me they've stopped reading, and that's a red flag. Asking the same questions over and over. So we move on and we see here Alzheimer's Association has 10 signs and symptoms, and I'll let you kind of take a look at those. But we're really talking about memory loss that disrupts daily life, challenges in planning, solving problems, difficulty completing familiar things at home, confusion about time or place, trouble with visual images, new problems with words or speaking, misplacing. Misplacing may not be an issue, but being unable to sort of retrace your steps, poor judgment, changes in judgment, social withdrawal, changes in mood and personality. Now, any one of these things could mean a lot, right? Meaning it's not unique to Alzheimer's, these kind of symptoms, but I think in combination, and especially when you have several of them, you start to then, I think, move towards getting a better assessment and further understanding of what's happening. So ideally, in a perfect world, and our medicine system, our medical system doesn't quite work like this, but ideally we have a primary care physician that is doing our blood work twice a year, looking at everything from vitamin B to vitamin D to your thyroid. And most of us do get blood work at least annually, if not more so. But the idea with Alzheimer's and really all dementias is that we've excluded every other possibility first. A B12 deficiency, if you're extremely low in B12, it will appear as if you have dementia. Even delirium, I have met on more than one occasion somebody who's had a UTI or even post-surgery and is very confused and they call it dementia. It's not really dementia, it's delirium, because delirium is different. It's brought on by either an infection or a medication or a medical condition, and it is treatable and reversible. Dementia, by definition, is not treatable and reversible. So it is important to rule other things out, especially if we can treat them and change the course. Medication side effects too. We're going to talk a little bit more about this because I went to a pharmacy lecture a couple of years ago, and the pharmacist basically said, if you're on 4 or more medications, the actual number of interactions between medications is incalculable. incalculable. Wow, that's a word. But basically, too many interactions to even count. So I'm not saying that nobody can be on more than 4 medications. What I am saying is we do need to be careful that medications can impact memory, can impact our brain. So here are some of the most common ones. What you'll see is categories here. Antihistamines, Benadryl, Sudafed, allergy medicine. The other class of medicine is pain medicine that really can cause memory problems, and anxiety medicine and antibiotics. So if we're again going back to our ideal scenario, we have a primary care physician, right, that would meet with us, do lab work, get a history, rule out anything that's sort of immediate obvious on any lab work or anything that can be detected there. Then they may refer to a neurologist. Sometimes I get referrals directly from primary care docs. It does depend. Neurologists will often want to do something like a picture, a CT or an MRI. A PET scan is more involved, and in general, it's harder to get the insurance to approve PET scans. Not to go too much into detail of imaging, but a CT or MRI is basically a static picture, right? Most of us have had either an X-ray or an MRI of some part of our body. It's a static picture. It gives us some information about big things like structure, of course, if there's a tumor, if there's anything unusual going on. But in the absence of something unusual going on, it doesn't fill in the blank and tell us, okay, so it's not a tumor, but it doesn't tell us what it is, right? So often, testing like I do is more indicated, because when I do cognitive testing and I look at areas like memory, language, visual, spatial, executive reasoning, I'm comparing people to other peers, same age peers. So I can get a indication of how are you doing compared to other people your same age. I have norms all the way up to 100. And so it's easier for me to sort of say, okay, this is normal aging versus this is not. And this is where you are compared to your peers, and this is where you're lower. And we kind of get more information that way. So what do we do if there's a problem, right? We have different medication options out to us. The ones that have been out, it feels like forever, have been Aricept, Exelon, and Namenda. Those 3 medications have been around for over 20 years. There's nothing new. Sometimes they'll combine them. Sometimes they'll change the dosaging and rebrand them. But honestly, it's the same essential medications. Those 3 medications have limited usefulness. So what do I mean by that? The way those medications work is by increasing chemicals in the brain that help us learn and focus and help memory, or by decreasing some other things that inhibit our ability to learn. So they're just increasing or decreasing chemicals. They're mildly altering. Now, do they help? Absolutely. Do they help for a long period of time? No. So our best guess on those kind of medications is it helps slow things down for people 1 to 2 years. Beyond that, there really isn't a lot of utility. And I've met many people that wind up on both, especially in more moderate stages of dementia. And at some point, we withdraw those medications because they're no longer really helpful. Aduhelm is the newer one. That medication is different. It is different in many ways. What Aduhelm does is actually bind with beta amyloid and helps you eliminate it from your body. So beta amyloid is a protein. All of us have beta amyloid in our brain. It's normal with aging, it's natural with aging. But what happens with beta amyloid is it will accumulate in certain ways, including in that hippocampus area that we were talking about in that brain slide. And what happens when you get an accumulation of beta amyloid is that it does seem to be a precursor and involved in Alzheimer's disease. Alzheimer's disease is complicated. It is not one single chemical reaction that's changing in our brain. It is a bunch of things changing. So Aduhelm, what it is doing is going in there, binding with the beta amyloid, and then your body is basically eliminating it. You're peeing it out, so to speak, right? What we have found with clinical research, we've been looking at this drug for a long time, is that it is helpful in stopping and slowing, almost stopping the progression of Alzheimer's disease at the beginning. And I want to say that again, when we've involved people in studies with Aduhelm that have more moderate dementia, that are really more progressed, it shows less ability to slow anything down. Furthermore, it does not reverse anything. So people ask me a lot about this medication. It does not help people go backwards, so to speak. It won't help you recover, but it will help stop progression. So again, I kind of want to focus in on it helps stop progression and further deterioration, but it does not necessarily mean you recover, okay? Now, there's some controversy around this medication, and I won't spend a lot of time on it, but currently, so you all know, Medicare is not covering it unless you are involved in a clinical trial. So Renstar is doing clinical trials on Aduhelm. Many research facilities around us in the villages and the greater area around where we are doing research clinical trials. As of right now, that's the only way you can get that medication. It is costly, and that's part of why Medicare premiums, and I don't know if you're into watching any of that, have changed somewhat on the IV infusion, because Aduhelm is an infusion once a month. It's not something you take orally. So April, though, I do understand Medicare is being asked, there's a lot of petitions going around asking for Medicare to consider covering this medication outpatient. And I'm not trying to get political, but I know there is a lot of petitions out there, and Medicare is, I think, coming up down the pike in April with some other kind of review to decide, will they cover it or not? Okay, so wow, that's a lot on medication, and I'm sure we'll come back to that. But there's other things we can do. Exercise. Some of the best research I've seen in the last 5 years is not about medication. It's about exercise. The impact of moving, the impact of increasing blood circulation to our brain. Our brain responds. Our brain has a plasticity throughout our life of recuperating, regenerating, benefiting. So when we exercise, we've seen on those PET scans an increase in the size of that hippocampus, which is really where that memory center is focused, and a more efficient use of dopamine. So there's no question, there's such a big part in exercise. I tell everyone that I meet, we have to move, we have to keep moving. We cannot slow down, even if our body wants us to. We have to sort of resist that, because going in that direction increases the speed of aging for everything, for our brain as well as everything else. Heart health, there's a long history of, we treat our heart well, we treat our brain well. There's a strong connection between your gut and your brain. And there's many people talking about how changing some of the gut and the balance in your gut and sort of the, see, I'm having word finding problems now. The stuff in yogurt that sort of helps with our gut, how it's also beneficial for your brain. What are the other ways that we treat and manage dementia? Planning. There is a lot of planning involved. Most of the people I talk with, I kind of say, well, if you have this information, how does it help you? And it helps with everything from driving to living situations to power of attorney. I mean, having this kind of information gives us an opportunity to plan, especially if we get it far enough in advance that we have a lot of time to figure some of this stuff out. Counseling, socialization, all of those pieces are important in sort of the treatment and management. I want to talk about sleep, because sleep is a huge factor too, that really does impact how fast we age, how quickly our brain changes. So sleep apnea is really a common problem, especially in people over 65. Obstructive sleep apnea has all kinds of side effects, right? It can affect our mood. It can affect our ability to drive. It makes hypertension worse. It increases your chances of having a stroke. Sleep apnea, there's more than one kind. Obstructive is sort of the kind that involves our mouth positioning in our tongue. And there's lots of interventions, including CPAPs, but even more recently, Inspire, other kinds of even pacemaker type devices have been really coming on the market to help with sleep apnea. If you don't treat sleep apnea, your brain will age much quicker. Your chances of developing a dementia, not necessarily Alzheimer's, but it can be Alzheimer's, goes way up. And your risk of a stroke goes way up. So I am really a big proponent of looking at sleep, finding out about sleep, getting as much information I can about sleep. Because the other thing, well, let me just tell you, for people who don't know, many people are already familiar, but sleep apnea really is a loss of oxygen while you're sleeping. And if you can imagine, we all got familiar with the finger pulse oximetry meters that with COVID, everybody was very sensitive to measure their pulse ox, right? With COVID and breathing and all of that. Well, what happens with sleep apnea is your blood oxygen, your loss of oxygen to the brain starts to go down too low. And it creates a situation where you're suffering a mini stroke is harsh, but it can be seen. It can be seen if you have sleep apnea and you have 30 to 40 episodes a night over 7 nights a week, over, how many weeks in a year, how many years, and we keep letting it go and go and go. We see it on an MRI. It looks like little white dots all over your MRI, and it does show up as microvascular disease. It does show up as small vessel disease. It shows up on MRI. So we know that there's an accumulation of effects. Sleep is important. And the other part of sleep that's really important is your brain naturally clears that beta amyloid that I was talking about while we sleep. So if we are not getting restful sleep, enough sleep, moving through the sleep cycle and getting our restorative sleep, we're not clearing beta amyloid like we should. And that creates other problems. Okay, moving on. So can dementia be prevented? No, today I can't, sit here and say we have a cure, but we can slow it down. We can reduce our risk. We can be proactive with our health. And here's how we do it. So we talked a little bit about exercise and the real benefit of exercise to our brain, maintaining a healthy weight, eating healthy, drinking alcohol in moderation, obviously no smoking, and monitoring our blood pressure. Exercise, again, even small bouts of it, there's lots of research to talk about how it boosts our cognition and how it creates miracle grow for the brain. And I think that's a very powerful thing. We think about, what we give to our plants. How do we give it to ourselves, right? And this is how we do it. We do it through exercise. Food. There's a lot of stuff coming out about food too. The MIND diet is not new. It came out around, I think, 2015, 2016, but it's a research-based diet. And what the researchers did is took the Mediterranean diet and took the DASH diet, the cardiac DASH diet, and they combined some things. And they followed people for 5 years, a huge sample, about 1,000 people, I believe, 58 to 98 years of age. And what they found is this. Oh, and they did compare it to so that you were in one of, I think, 4 categories. Your regular diet, which was no intervention. Then you were in the Mediterranean diet or the DASH diet or this MIND diet, which was specifically pulled together. And what they found is with this MIND diet, if you were strictly following it, you reduced your chance of developing Alzheimer's in half. There is nothing else that can promise that. There is no other drug, there is no other vitamin, there is nothing else in our repertoire of research and information out there that will reduce your chance of developing Alzheimer's in half like this. Moderately adherent. So what does that mean? Most of the time, right? Most of the time, you still benefited, even if you were moderately adherent to the diet. 35% reduction in the rate of Alzheimer's disease. This is huge. And this is, again, is a further evidence connecting our gut to our brain, which there's been a lot of talk about that. So let's talk just a little bit about the MIND diet because people want to know what's in it, right? Green leafy vegetables. So these is the 10 categories that you must do, although I'll be honest, the wine is not a must, but vegetables, nuts, berries, beans, whole grains, fish, poultry, olive oil, wine, they say you can have 1 glass a day. Now, when I say must do, and also you need to, write all this down. If you Google the mind diet, there's books, there's all kinds of information out on it now, and it keeps being researched and looked at. It's an easy thing to find. But then let's talk about the general trends of what to avoid. So red meat, it talks about no more than 4 servings per week. Butter and margarine, really looking at less than a tablespoon. Cheese, eating cheese very sparingly. Pastries, sweets, again, moderation or minimal. And fried or fast food, really trying to eliminate that. It is worth talking about alcohol and what's happening. It's interesting that we're seeing an increase in alcohol consumption in people over 65. And I'm seeing that more too. I don't know if it's, I can't say I blame the villages, but there are certain communities that seem to kind of reinforce happy hour every night that I think we're going to find has something to do with some of the lifestyle and some of the drinks. So what's the bottom line on alcohol? Interestingly enough, the NIH recommends no more than 7 drinks per week, no more 3 in a day. I think the reality is this: there's probably a sweet spot, which means you can drink none to a little and be fine. But at a certain point, and nobody knows exactly what that point is for us individually, but as a group, at a certain point, the more you drink, the faster your brain changes. Men who drank 2.5 drinks per day, they've done research, look at moving your brain, accelerating aging by 6 years. So that's significant, and I think something to be mindful of. The bottom line with alcohol is our body turns it into sugar. And sugar affects our body, certainly in the way of something like diabetes and our glucose, but it also affects our brain. It is considered an inflammatory variable. So we're going to talk about inflammation and all that kind of stuff. And everything with the mind diet, with exercise, is all focused on reducing inflammation. So I think the other piece we just have to be mindful of here is that alcohol is considered something that would increase inflammation as opposed to decreasing. The other things with alcohol too is that we, as we age, we become more sensitive because our body mass changes, and actually the amount of water in our body starts to change a little bit. We don't need to drink as much to feel it and have a higher blood alcohol level. So there's some real indications of you're more sensitive to alcohol. It worsens things like sleep apnea, diabetes, blood pressure, and it also interacts with other medications. And so things like balance and falling become more of an issue, especially if you're combining things like alcohol with Benadryl or alcohol with pain medicine. I feel like we're at a higher risk then of things like falling. All right, so I guess that's sort of the brief, let me stop sharing there, slideshow there, and I think we'd have time for questions.
Okay, so folks, if anybody wants to raise their hand, remember the reaction button is at the bottom. I know Lisa has some questions that she's going to ask you, so this gives some time for folks who want to raise their hand to go ahead and do so. Go ahead, Lisa. Oh, unmute yourself. There you go.
Okay, thanks. I'm just unmuting myself. Okay, so let me ask you some questions. What if someone is experiencing memory loss and they don't currently have a neurologist? What do you suggest they do?
So I guess there's a couple of things you could do, right? The primary care doctor does have some tools available to them. So talking with your primary care doctor, that's certainly the first thing that I recommend. But the second thing is there are opportunities like Renstar to do free memory screenings. It doesn't have to be going to a primary care doc. If you're concerned and you want a memory screening, Renstar does them all the time, as well as many other places. And you can look for a free memory screening to get a check-in. Now, I'll be honest, there's pre-memory screening is just what it is, right? It's a brief little assessment. It's not perfect. And, you know, if you have a complicated medical history, I do recommend a little bit further of a checkup. You know, Medicare, really over 65 and over approves evaluations once a year, because I do think even having baseline evaluations is helpful to see if you change from year to year. And maybe not every year, maybe every other year. I'm just saying it starts to become something that we should follow closer.
And if someone were interested in getting involved with Renstar, do you have spots available now if somebody wanted to call up and get into a test study? Do you have availability now?
So what the best thing to do would be to put together a list of names and numbers and send it to Alyssa, and then
Okay.
Alyssa can help coordinate that.
Perfect. Okay. And is there anything that I could do at home to help with my memory? Do you suggest anything besides the diet, besides the exercise? Any suggestions of just day-to-day things that we incorporate into our lives?
Well, a lot of people do ask me about things like crossword puzzles and Sudoku and stuff like that. And I'm always about, you know, interested in and kind of looking at, here's the bottom line. Socializing, getting out and doing activities and engaging with other people is very important. Whether you do crossword puzzles or not is not going to determine how your brain ages. It's whether you remain active, whether you remain healthy, what you're eating, and how much you're moving. Those are the biggest factors.
Great, thank you. And
Lisa? Hey,
yes,
Lisa, we have 3 people who have their hand raised. Could we
Perfect.
take Bonnie's question next?
great. Go ahead,
Go ahead,
Bonnie.
Bonnie.
Hi, this is Bonnie Stein, and my question for you is the dementia or Alzheimer's patient. Are they aware? For example, I'm thinking of my mother who's 93, and when she talks to us, she's talking gobbledygook. So obviously she has been already diagnosed. But I don't see that she realizes that we're not understanding what she says. And I don't think she doesn't understand what she's saying. So I'm wondering, does the Alzheimer's patient understand? Is it clear to them that they're not making any sense?
No, and I think you bring up a huge point, which is 95, well, let's say 90% of the time, people are referred to my office because their loved one or someone else in their family is concerned about them. The person that has the memory issues, often if they say, they say, oh, I have some mild forgetfulness. But if I were to ask, and I do this, I give the same questionnaire to somebody that I'm evaluating and also a family member, rate on a scale of 1 to 10 how concerned you are. Almost always with Alzheimer's, the level of concern of the person with the memory problem is pretty low, and the level of concern with the spouse and the family is much higher. The reason for that is part of the brain that's involved in Alzheimer's does seem to be about awareness of our own change, awareness of how we are changing and declining. We are not as aware of it most of the time as everyone around us. Now, it doesn't mean that there aren't some people that do recognize that they're changing. I get that, but it sets up a dynamic that's often difficult because people don't often see themselves the same way and can't appreciate how much they're changing and declining with Alzheimer's. So,
Okay.
Thank you for that.
You.
Nancy Nicholson, you're next.
Thank you. Bonnie, you mentioned under the medication Synthroid, which is a thyroid medication, and then you mentioned hypothyroidism under one of your other slides, and that's something interesting. I never heard about that being part of an Alzheimer's type diagnosis. Is this something new that they have found? And can you go into what does the medication, does that just cause brain fog?
Yeah, I think the issue is honestly the thyroid functioning, right? So low thyroid really can be an indication of a thyroid problem, not a memory problem. And then you treat the thyroid problem and people feel cognitively more alert and better. The side effects, though, of some of the medications that help us can also affect us, right? Now, I'm not usually worried, I'll be honest with you. If you're taking thyroid medication and your thyroid's stable and you have not had a lot of fluctuations in your thyroid functioning, I'm not concerned about Synthroid or Armor or any of those medications to treat thyroid. In general, they're not enough to cause a dementia or to create Alzheimer's in the brain when it wouldn't have happened anyway. You see what I'm saying? So it's more of a factor, I think, the thyroid, of just making sure that it is where it's supposed to be, that those those labs are within normal ranges, and that the thyroid issues are being treated appropriately.
Oh, okay. So basically, as long as you're able to keep your thyroid under control, it's not a problem. It's more in people that are undiagnosed or don't take care of their medication. Okay, that was quite interesting. That was a sort of a surprise there. Thank you.
Absolutely.
Go ahead, Lisa, with your next question.
Does Chris have a question?
Yeah, but I can't get her to unmute herself, so just go ahead.
Okay, all right. So a question for you. Should I be taking any supplements to help with prevention of memory loss?
Yeah, people ask me a lot about supplements, and I'll be honest, because I am very much into clinical research, I am not a big supplement person. Doesn't mean that I don't believe in any supplements, but there's a lot of companies, and I will throw Prevagen under the bus, I'm happy to, that promote that they have a pill that either stops memory loss or helps you with your memory, and there's zero proof of it. In fact, it's being sued actively by more than one group because there really is nothing that would suggest from a clinical research perspective that would be helpful. So I guess what I am guarded against is companies that take advantage of a concern and fear that people have of developing memory problems and then promote things that don't work. And I get calls on a regular basis, all kinds of things, from metal caps on your head with electrostimulation to, I'm never ceased to be amazed at the amount of things coming out. And I do agree that groups like the Villages are being targeted. They're being targeted and they're being taken advantage of. So I'm vigilant about supplements. If you're taking a vitamin B supplement or you're taking vitamin D because you have deficiencies, that makes sense. But we want to get as much as we can from our food. And I'm not a big believer overall, unless you need a supplement, unless there's an indication for it, which there are, but not for memory. There's nothing out there that has been proven in terms of a supplement. They're not FDA approved as a treatment. It's considered, over the counter, and there's no good research to back them up, unfortunately.
Thank you for that.
Okay, Chris, can you unmute yourself, please? Go ahead, Chris.
Yes. Hi, Bonnie. We're always told how bad the chemicals in diet soda are for the brain. So I drink a Diet Pepsi every day. I don't drink coffee, don't drink alcohol, even though I live in the Villages, and I drink a lot of water. So I'm just wondering what you have to say about the diet soda world.
Yeah, I haven't read anything, Chris, that suggests that having diet soda leads to dementia. What I have seen is a connection between what's happening with some of the sweeteners in anything from diet soda to even some of the coffee sweeteners and things like that, is that our brain and body respond to them often as sugar, even though they're not sugar, that they don't always decipher the facts. So they can still impact us, whether it's through labs or things like that. But I think you'd have to be drinking an awful lot of diet soda to worry about that. I'm not of the impression that, especially what you're talking about in terms of once or twice a day, that's going to be any significant factor.
Okay, thanks.
Nancy, can you unmute yourself, please? Okay, we're gonna go to Claire. Yeah, Claire, I see you, hon. Can you unmute yourself? You need to unmute yourself. We can't hear you, Claire. There you
Okay.
go.
What was the name of the supplement again that you said really didn't help, that they're touting that does help?
Revigen.
Would you spell that, please?
Yeah, I think it's Prevagen.
Thank you so very much.
The
Nancy,
newest,
do you have a-
Does
Do you have
maybe
any more
Nancy want to
questions?
type your question?
Yeah, I can't get her to unmute. I've asked her.
Yeah,
but
I thought maybe she could type it. I'll go on to another question and then hopefully Nancy will have time to type.
She can't.
Um,
Yeah, she's on a iPad. I think that's why it won't let her. Nancy, go ahead and send us your question. I'll ask it for you.
Okay, so how can people get their memory evaluated if they don't have a neurologist?
yeah, so we, I think doing a free memory screening is a great option. And also talking to your primary care doctor. They often do have assessments, whether it's a mini mental, things like that, that can be helpful to do as a beginning step. But I actually think the screenings that most of the clinical research companies like Renstar do is more thorough than even what your primary care doctor would do. So I would recommend that. I think there's at least 2 or 3 companies, including Renstar, that do memory screening all the time.
Great, thank you.
And so
Okay,
Nancy was asking about a support group for caregivers. I gave you Josephine's name. Josephine is one of our advisors, and she can hook you up with the support group, with our caregiver support group. And I put her name and her number right in the chat box for you, Nancy. Thank you.
Yeah, great.
does anyone have any other questions? This has been very informative. It really gives us a place to go for those of us that are concerned with people that we meet. I mean, free screenings, who wouldn't want that, right? And then even all the testing that you do, amazing, right? So people get a true picture of where they're at, if there is something to be concerned about. And then going forward, especially, you know, in this day of COVID, had people not done the research for the vaccines years ago, where would we be, right? So here we are on the cutting edge of learning more about memory loss, how to prevent it, what drugs could possibly change the lives for our children, right? Ourselves, our children, our grandchildren. So amazing work that you're doing, Bonnie. And again, you know, congratulations for just being involved with this great organization. It's not that far away from the villages, literally, you know, Ocala, 20-minute ride. But pretty amazing work that you do every single day. We are so excited that you were on the show and that you shared all this information with us. And now we have a place to go and again, encourage our friends, our family to get involved with studies. So thank you for all you do. Is there anything else you'd like to add, Bonnie, before we go?
No, you know, I'll just put maybe my email on the chat if anything, you know, any follow-up that people didn't get a chance to ask or follow up in any way. I certainly am, you know, it's the easiest, most efficient way to kind of communicate these days, right? So.
Yep. So let me ask you this. If someone wanted to meet with you in your office, are you taking clients now? Are you're taking on new patients?
Yes, I do. There are always some insurance issues, you know, around that. So it does sort of depend on some particular details, but absolutely. If anybody has any interest questions or even resource questions, email me and I'm happy to respond.
That's great. I do refer a lot of families to neurologists. Sometimes here in the villages, we have so very few, you know, doctors that people can meet with for memory loss. And the wait sometimes is months and months, right? So knowing that you're available not too far away, that would be a great resource for the families that we work with all the time. Sometimes, again, maybe a personality doesn't match, with the clinician. And so people maybe get the wrong impression, but it's nice to have someone like you, again, not too far away, with all the expertise that you have that could, again, help them through a study, or even the caregiver themselves, right? Even though the loved one may have dementia and be far along in their journey, the caregiver or even the children of the caregiver would be great for research, right?
Absolutely.
So
Sorry,
thank you for.
I wound up sending, oh, okay, Maureen said she would send it. I think I wound up sending something private and I didn't mean to. I meant to.
That's okay. We'll make sure we have a slide to all the people that participated. We'll send out your contact information. So again, they can share it. We work with families to help them find resources. So that's what my company does. I'm a free resource here in the villages. And a lot of people have a lot of questions on, again, caregiver burnout, memory loss, where do I go for, again, support groups, getting caregivers in their home, right, because they're not ready for placement yet. But again, I work with families to think about their 3 a.m. plan. What happens to the caregiver at 3 a.m. And to the loved one who has memory loss, right? So I help about 1,000 families a year. I'm very blessed to be able to do what I do. And Maureen, Josephine are great team members who, again, work to create these great educationals for our families so that they can learn. But what we hope is that people, plan ahead, right? Plan when you're newly diagnosed or beginning to, again, come down to the villages. You're young, you want to be involved with the study, give back. So we really encourage our families to get plans and also be proactive in their health and their care, right? So.
Absolutely. That's wonderful.
Okay, so I think the biggest thing is, we've learned a lot today. There's a lot of things certainly you've shared with us. We look forward to maybe having you on again, your wealth of knowledge. And again, families that want to seek you out, we'll make sure that they have your contact information. And again, for getting involved with Renstar studies, I know you have a lot of studies going on there. So again, if it's not a memory loss study, there are some other studies I think that they do also involve. So again, it's a brilliant organization. We're lucky to have you so close. So thank you again for everything today. And thank you everyone for joining us. We've learned a lot. Okay, have a great day, everybody, and stay safe.
Yes.
Thanks. Okay, thank you. Bye-bye.